So my name's Tierna Ramsay, Chartered Educational Psychologist, and I've been working at the Edinburgh Practice for just over a year. One of my roles within the Edinburgh Practice is to carry out assessments for learning difficulties and wider learning needs. So this would include specific learning difficulties such as dyslexia, Dyscalculia, which is a specific difficulty working with numbers, and Dysgraphia, which is a specific difficulty with handwriting. And I also carry out assessments for giftedness. So I carry out assessments for children, young people and adults. So we carry out the assessment within a quiet, calm setting. It's a one-to-one assessment. To begin with, I carry out detailed consultation to find out some background information and to really kind of focus on what the goals of the assessment will be. Following this, I carry a cognitive assessment. I use the Wechsler Intelligence Scale, and this looks at different areas such as verbal skills, visual spatial ability, fluid reasoning, working memory and processing speed. And the tasks could be questions that I'll ask you to answer, problem solving, thinking of sequences and remembering information. So that would be at our first appointment. At the second appointment, I would then carry out some attainment tasks, again using standardised tools such as the Wechsler Individual Achievement Task. And I would use other tools depending on the focus of the assessment. And this would be looking at things like reading fluency, reading comprehension, spelling, handwriting, maths, problem solving and numeracy skills. On our third appointment, I would then have a detailed feedback, kind of going over the outcomes of the assessment, and then I would provide a comprehensive report that can be shared with schools, colleges, universities as appropriate. And within that report, I would provide a detailed information about the assessment as well as recommendations and future support strategies, possible advice regarding assessment arrangements. My other role within the Edinburgh Practice is I work with children and families when a neurodevelopmental condition such as autism or ADHD has been identified. I would offer a consultation and then provide advice and strategies that can be used both at home and at school. And I can also attend child planning meetings where that would be helpful to ensure that the right supports are in place. For the assessments into specific learning difficulties, this would typically be 2 or 3 appointments at the Edinburgh Practice depending on the focus of the assessments, and each appointment would typically last around 2 hours. So I think the Edinburgh Practice offers a very warm and nurturing environment for our children and young people, especially if they're feeling a little anxious towards the assessments. Within the rooms, as I said, it's a one-to-one assessment in a calm, quiet environment. The child can take as many breaks as they need to, depending on their age and stage. And there's nice areas to go to for the children where there's nice books and toys that they can play with in between the assessments. There also currently isn't a waiting list for educational psychology assessments, so the assessment can be carried out quite timely with reports which can then be shared with school.